for that, I thank you as well, and I'll yield back to the gentlelady.
And I yield back, Mr. Chair.
Thank you very much. Gentlelady from New Mexico is recognized for any questions she may have for the panel.
Thank you very much, Chairman. You know, it just strikes me as, I'm flying in and looking at the materials and thinking what the last many years have been like, that basically Americans want to be able to have affordable, accessible health care. And they want to make sure that health bills to pay for the health care they need doesn't bankrupt them. And that what the Affordable Care Act did, and what we did last year in the American Rescue Plan and the Inflation Reduction Act, was making sure that health care was more affordable so that we could make sure we grew the middle class. And they did not have to worry about bills for health care that would bankrupt them. And we were able to do that because we had guardrails, because we had protections to make sure that when you got pregnant, when you had a very serious illness, when you had cancer, that you were not then bankrupted for the care that you got. And that, as the ranking member pointed out, that the pool was large enough to make sure that the risks were spread out. And, it worked. In 2022, the uninsured rate stood at 8%, the lowest level in history. Finally, 92% of Americans now have access to health insurance and health care. In fact, following the American Rescue Plan, 16.3 million people signed up for coverage through healthcare.gov. What we did was save $800 per year in premiums. So what Americans want is for us to keep moving in that direction, and what we see instead coming out of these Republican bills is an attempt to go backwards, to make it harder for families to afford health care. Ranking Member Scott, we've heard that association health plans won't be able to set premiums based on health, but could they use age and gender as a basis?
Well, they would get priced by, you could be priced by experience. So if the association is running up higher bills, they would have to pay higher premiums.
So if they were older, if you had a workforce that is older, if you had a workforce that had more women in it, would you likely be paying a higher price?
And sicker, yes, you'd be paying a higher price. And this doesn't reduce overall health care costs. You've just shifted the cost into an association. The association will always have below average costs because the consumer will look, I can join the association, oh, wait a minute, their costs are higher than the Affordable Care Act premiums. I'm not moving. So you won't buy the higher premium association. So some associations will have a high price, some have low price. The high price won't be viable. So yeah, every association will have a lower than average price. And it's simple arithmetic. Everybody left behind will be paying, on average, more. And so the more associations you get coming out paying lower prices, the higher everybody else. And if you got a pre-existing condition or you're in a group with people with pre-existing conditions, you'll never be able to get an association. So you're just stuck with a gradually increasing premium. All the healthy people over here getting lower premiums, and you know what that looks like because it looked like that before the Affordable Care Act. People with pre-existing conditions couldn't afford insurance.
So, Chairwoman Fox, the new association health plans would, under the AHPA that's presented here, would not be required to cover maternity or prenatal care. Is that correct?
Say again, I'm sorry.
They would not be required to cover maternity or prenatal care.
No essential benefits.
No essential benefits. That was a question for the chair, but thank you for answering it. And ranking member, was there an amendment in Ed and Workforce to make sure that maternity and prenatal care would be covered? Ranking member Scott?
Say again.
I recall there was actually an amendment because people are worried, women are worried that we want to make sure prenatal care is covered. I mean, I gave birth to 3 babies and I had many other pregnancies. It's dangerous.
And if maternal coverage is not provided in the association, then disproportionately those costs are borne by those left behind.
So what strikes me on
Mr.
this
Scott,
bill.
could I ask you a question? Would you yield a second? What do
Yes.
you mean by those left behind?
Those-
Who are those people? Because you've referred to those people. If they're not in association health plans, they're people left behind. Who are they?
They're the people who are buying insurance on the marketplace.
Okay, well, that doesn't make sense to me. By what you're saying is, if they're not in association,
Right.
health plans, they can get lower prices
In the
association
association, that's right,
health.
that's right. You're right.
Okay, but if they're eligible to join the association because they're in a certain category, why would they be left behind? That's what I don't
No,
understand.
the people who join the association will enjoy lower health care costs. Everybody else that they just left will be on average paying more. The health care costs didn't go down. This is simple arithmetic. If you have a group of people with insurance.
Then, of course, they could go into the ACA, of course, right?
That's where
If it's a better deal for them, then they could go in the ACA. So nobody has to be left behind in our culture.
I shall.
No. We don't have association plans now. If you have everybody in the Affordable Care Act, if only healthy people can join the associations, because sick people will get priced out and they won't join.
Mr. Scott, that is simply not true. And I think we have to say it over and over
Okay,
again.
this is arithmetic.
So the Affordable Care Act was carefully crafted to make sure that everybody would be included, that there would be guardrails that would cover things like maternity care, things like addiction and behavioral health, especially now that we're facing all of that. And what we see with AHPs, it is not covering those. It is not required. And so instead of addressing some of the major healthcare issues, we are not addressing them in the AHP because we're leaving those out. Then we are like discriminating in essence within the health insurance
And
plans.
maternity care is very expensive.
Right.
And if you can have a plan that doesn't cover maternity care, you can save money. But we have, under the Affordable Care Act, everybody pays average. You lump everybody's costs together and everybody pays average. Now, if you want to pick and choose, the maternity care is very expensive, and if I can get a plan without maternity, I can save some money. But everybody else who is left behind will be paying more.
So basically,
This is arithmetic.
Right, it's simply arithmetic, but the focus on women right here, right? Because we are seeing across the country and even in this Congress that Republicans want to ban women from getting reproductive health care, but they won't require that all insurance plans, including AHPs, cover maternity care. That's the disconnect here, and that's what I think we are seeing is this is simply wrong. With that, Mr. Chairman, with the outrage about this disconnect and mistreatment of women, even though it is more expensive to treat us, we should be treated for all of the care we need. With that, Mr. Chair, I yield back.
Thank you very much. Gentleman from Kentucky is recognized for any